Hello, and welcome to the final portion of our anatomy segment. We are finally about to finish up on this. Sorry it's been so long since the last time I made one of these. It's been a wild month. I guess that's the good part about a self-study course is that you can take it at your own pace, and I definitely needed that. So again, I'm sorry. Hopefully, future videos will be out with a little bit more quickness. In this section, we'll be covering the vitreous, retina, optic nerve, visual pathway, and ocular muscles. The vitreous is a thick, viscous, jelly-like structure that occupies the vitreous chamber in the posterior concavity of the globe. It occupies 2/3 of the eye's volume and is surrounded mainly by retina. Anteriorly, it forms a slight depression behind the lens. The vitreous is attached to the lens around the circumference of this depression. The vitreous is 99% water and normally quite transparent. The vitreous is not just an inert jelly. Within its body, fine collagen fibers crisscross in a scaffolding manner. This matrix is filled with a viscous mucopolysaccharide called hyaluronic acid. Hyaluronic acid is a great shock absorber and can compress and rebound slowly. This is important in injuries to the eye from things like a fast-moving ball. The envelope surrounding the vitreous is anchored to the more forward part of the retina, the ora serrata, and at the head of the optic nerve along the major retinal blood vessels. If the vitreous shrinks, the resulting tension on its anchors can produce a tear in the retina. This may permit the adjacent vitreous to enter between the choroid and retina, causing a retinal detachment. With age, some of the collagen fibers of the vitreous often break away from the main structure. These may condense into strands that float freely in the watery sections of the vitreous. These floaters are usually harmless and disappear over time. The retina contains all of the sensory receptors for transmission of light and is really part of the brain. The retinal receptors are divided into two populations, rods and cones. Rods function best in dim light and provide relatively poor vision. Cones function best under daylight conditions and enable us to see small visual angles with great acuity. There are far more rods than cones, with an estimated 125 million versus an estimated 6 million respectively. Color vision is totally dependent on the integrity of the cones. The cones form a concentrated area in the retina known as the fovea, which lies in the center of the macula lutea. Damage to this area can severely reduce the ability to see ahead. Rods are distributed in the periphery of the retina, and damage to them results in night blindness. The ora serrata is the junction of the retinal periphery and the ciliary body. Here there are no cones and only a few rods. The retina is firmly attached to the choroid at the ora serrata, so retinal detachments never extend beyond this point. The posterior layer of the retina is called the pigment epithelium and is firmly secured to the choroid. Retinal detachment occurs as a result of cleavage between the retina's anterior layer and the posterior pigment layer. The optic nerve is located at the posterior portion of the globe and transmits visual impulses from the retina to the brain. Only the head of the nerve, also known as the optic disc, can be seen by ophthalmoscopic examination. Because the optic nerve contains no sensory receptors, its position corresponds to the normal blind spot of the eye, which we all have. Retinal arterioles and veins branch out from the surface of the optic disc. They divide soon after leaving the disc and extend out to the surface of the retina to supply the inner 1/3 with nutrients. As the optic disc enters the globe, it goes through a fibrous sieve-like structure called the lamina fibrosa. The optic nerve emerges from the back of the eye through a small circular opening. It extends for 25 to 30 millimeters and travels within the muscle cone to enter the optic foramen. From there, it travels another 4 to 9 millimeters to pass into the intracranial cavity, where it joins its fellow optic nerve to form the optic chiasm. As the retinal fibers leave the optic nerves, half of them cross to the opposite side. Those that cross are derived from retinal receptors nasal to the macula. This crossing forms the optic chiasm. From the optic chiasm, the nasal fibers from the nasal half of one eye intermingle with the fibers from the temporal half of the other, forming a band called the optic tract. Fibers in the optic tract continue toward a cell station in the brain called the lateral geniculate body, which is a relay station from which fibers spread out like a fan and extend to the parietal and temporal lobes of the brain. They continue to the visual striate area located within the occipital lobe. Here, conscious recognition of visual impulses takes place. And here I have a helpful diagram going over what we just discussed with the optic chiasm and optic tract, just showing the paths that they take and how they get to the occipital lobe. There are 6 ocular muscles that move the globe. The medial rectus, which moves the eye towards the nose, known as adduction, the lateral rectus, which moves the eye horizontally to the outer side, known as abduction, the superior rectus, which elevates the eye, the inferior rectus, which depresses the eye, the superior oblique, which intorts and depresses the eye, and the inferior oblique, which extorts and elevates the eye. The rectal muscles are very close to the limbus. The medial rectus lies approximately 5.5 millimeters from the limbus, and the lateral rectus approximately 7 millimeters from the limbus. The rectus muscles are not normally visible due to being covered with conjunctiva and subconjunctival tissue. Because they lie on the surface of the globe, they are readily accessible for muscle surgery. The oblique muscles are inserted behind the equator of the globe. Got a couple different diagrams here. So this one is the ocular muscles of the right eye viewed from above, the ocular muscles of the right eye viewed from below, and the right eye viewed from a couple different directions, laterally, anteriorly, and medially. And here I've just got a table outlining the ocular muscles and their different actions. Personally, for me, I find that tables are a little bit easier to follow than lists like I gave earlier, so this might be worth copying down. In the lid, the levator palpebrae superioris muscle elevates the lid. A weak or absent levator muscle causes ptosis. The orbicularis oculi muscle closes the eye during winking, blinking, or forced closure. And with that, that is the end of all of the anatomy. So we've gotten through all of it. I know that it took me forever to get this video out, and I'm sorry for that. Ideally, future videos, instead of breaking them into parts like this, because they ended up a little bit shorter than I was expecting, I'll just do one big long video covering a whole chapter. I feel like that's maybe a bit better than these bite-sized chunks. So they may take me a little bit longer to get out, not a full month, but a little bit longer. And hopefully that's just a little bit better for everybody. That's all I've got for you. Thank you.